You have actually done the work of expanding Medicaid in a state. And so tell me, when you cut Medicaid, what does that mean for your constituents? And if we were living in an alternate reality where we're talking instead about expanding it, how would that make America more healthy?
Well, first of all, when you kick people off of their health insurance, they're still going to get sick, but they're going to show up at the hospital in the emergency room much later. They're not going to get preventative care. The cost to treat them is going to be a lot higher, and we all pay the rest. We were seeing...
Say that again.
We will all pay the rest. And we were seeing hospitals, especially rural hospitals, that were on the verge of closing before Medicaid expansion. And I think it's really important to understand that just because one person loses their health insurance, it doesn't just affect that person. It affects the entire system. The costs are going to be paid by the rest of us. Our insurance premiums are going to go up. Providers will close and people will die.
But Donald Trump has told us something very different. He said none of that will happen. And in fact, what he has said is that, yeah, some prices will be reduced almost immediately, right? So let's take a listen to the man himself.
Some prescription drug and pharmaceutical prices will be reduced almost immediately by 50 to 80 to 90%. Big Pharma will either abide by this principle voluntarily or will use the power of the federal government to ensure that we are paying the same price as other countries.
So you can kick people off and prices will go down and Big Pharma is going to, everybody, this is going to be one big happy.
Well, that's just a delusion. I mean, first of all, the experts that I am reading are saying you're not going to see prescription drug costs go down immediately.
Why not? Because don't you have to do that through... I'm sorry. The Inflation Reduction Act is how drug prices, prescription drug prices went down.
Right.
Wasn't that legislation that y'all passed?
That was legislation that Democrats passed in 2022 where they negotiated prices through Medicaid and Medicare that people would pay. What this president is talking about is he's saying, well, all prescription drug companies are going to reduce the costs, period, overnight. That's probably not going to happen. That's probably not going to happen for people who are on private insurance. But more importantly, even if your prescription drugs go down, if you don't have health insurance to pay the costs of it, you're out of luck. If you don't have a provider you can go to when you are sick, you're out of luck. And the costs of everything else are going to go up.
And that's the nexus I was hoping you would get to,
yes.
Because they have this craziness, Simone, that where they say we can cut all this $800 billion, right? Kick all these people off, drive prices down. You'll be able to still get your medicine. But wait a minute. Like you started your last answer, if you're out of the system, you're not going to access it the same way, and the costs are going to go up.
And I want to flag for you all, it's not just Medicaid that's on the chopping block. With the changes that this bill would make, this is effectively a repeal of the Affordable Care Act. And what the CBO has said is not just you have 8 million people who will be kicked off of Medicaid, but when you combine totality of what this bill is going to do, at least 13 million Americans will lose their health insurance either through Medicaid or through the Affordable Care Act exchanges. And again, they're still going to get sick. But when they show up for care, they're going to be very, very sick. It's going to be a lot more expensive, and we will pick up the rest of the tab in our insurance premiums.
It's just, you know what? Don't take my word for it. This is what's in the proposal. This is what's in Medicaid. This is the Medicaid portion of the Republican House proposal. Stricter eligibility verification, freezes states' provider tax, imposes 80-hour work requirement for able-bodied adults, requires some recipients who earn more than the poverty level to pay higher copays. It's like they're criminalizing or they're punishing people for needing care. Like, to be very clear, some people who are on Medicaid, if they are quote-unquote able-bodied adults, perhaps they're a 19-year-old whose parent died.
Or maybe they are taking care of a loved one who needs long-term care, and they find that it's better to do that at home rather than putting them in a nursing home. But, you know, I think what's really important to understand is when you get sick, you are going to get care in this country.
for now. Well, are you sure? Is that a guarantee that we can?
If you show
tell
up,
people?
if you show up in an emergency room that has not closed because they can't afford to stay open, then you will get care, and the rest of us will pay the rest. Now, these work requirements are actually red tape requirements, where we saw in Arkansas when they put work requirements in place, the red tape was so much that they kicked people off the Medicaid rolls, but employment didn't go up. With the provider tax, basically you are saying to states, we're already going to blow a hole in your budget by the changes that we're making to Medicaid and everything else that this administration is doing. But oh, by the way, we're going to handcuff your ability to pay the difference with limits on the provider tax, which states use to pay their share of Medicaid costs. So the whole thing is a mess. The whole thing is a backdoor way for them to repeal the Affordable Care Act, to kick people off of their health insurance, to make people less healthy, and people will die.
So this is the piece that is currently being legislated on Capitol Hill. There then, of course, is the executive order today that we saw from the president going after drug prices, which everyone wants to see drug prices come down. The problem is this executive order is completely unserious. It takes into account absolutely none of the nuances of the way these markets actually work. The fact that there are multiple markets, that there's Medicaid, there's Medicare, there's the VA, there's the commercial market. They all operate by different sets of rules. And I want you to help me understand this. What he is asking for is favored nation status. He wants our drug prices to be the same as other nations that don't pay as much, without recognizing that in those countries, their government leaders sit down and decide which drugs you get and thus the cost that is associated with them. So you cannot have those costs that he's alluding to without changing the fundamentals.
Correct. That is absolutely correct.
Just to piggyback on that, one of the fundamentals is the research component
that they're gutting.
That they're gutting in the process.
That's right. They're gutting it. They're firing the federal employees that help to provide it. They are putting caps on our research universities' ability to do this research. Again, you can't look at this budget bill in a vacuum. You have to look at it with everything that Doge and Elon Musk and Donald Trump have done since day one that is crippling our healthcare system, that is crippling our economy, that is hurting the American people, and they're sick of it.